I'm Kathy Powderly. I'm the director of the John Conley Division of Medical Ethics and Humanities here at Downstate, and had the privilege yesterday to meet Mr. Alfred Lacks Carter Jr. And in an open forum that was mostly students, which was awesome. And so he has been invited to be the keynote speaker for this Cancer Disparities Conference, and brings the life experience of being the grandson of Henrietta Lacks. And so I'm not going to say there is a description in the program of his background, but I'm going to let him start by telling you whatever parts of his story he would like to share with you. And then will have some mics so that we can take questions and hear from you what you would like to hear from Mr. Carter. And I'd like to start by thanking him and his wife Jewel for coming to Brooklyn, coming to Downstate, sharing their life and their experience with us, especially with our students, and I look forward to hearing even more about his story today.
Thank you. Good afternoon, everyone. I'd just like to say thank you for coming and participating in such a profound event, talking about disparities in cancer. As Ms. Powdery said, my name is Alfred Lacks Carter. I'm the grandson of Henrietta Lacks. My mother was Deborah Lacks. Growing up, there wasn't like a lot of talk about Henrietta, mainly because my granddad and his sons really didn't, they really didn't take how Henrietta was treated. In 1951, she passed away from cervical cancer. She went to Johns Hopkins Hospital for treatment, and back then the treatment was so barbaric, they were actually sewing radium onto her cervix, which was burning her from the inside out. My oldest uncle, Lawrence Lacks Sr., he was the only one who really had recollection of who his mother was, because my mom and my other two uncles and my Aunt Elsie were so young when Henrietta passed away. My mother was just 2 years old, so she never knew her mother. All these events transpired back then, and my granddad and my oldest uncle, they tried to block everything out. There was a trust issue between the family and Johns Hopkins. For years, my granddad and my uncles, they never knew that the HeLa cell existed. It was found out by mistake. A family member who lived down the street from my uncle and my aunt Barbara, the family member had a friend who worked at the NIH in Bethesda, Maryland, and she introduced my aunt to this guy, and she introduced her as Babette Lacks. And he was like, "Lacks, are you related to Henrietta Lacks?" And she was like, "Yes, that's my mother-in-law." And he went on to tell her about all these wonderful and amazing things that they were doing with her cells. And all this was unbeknownst to the family. So she went back and told my uncle, and he told my grandfather, and so they started to make calls, and they were still kept in the dark. They were told, like a lot of times they were putting, like HELA stood for Henrietta Lacks. They were saying that it stood for Helen Lane and Helen Larson, trying to cover up the fact that this was an African-American woman from Baltimore. So Rolling Stones did a very in-depth article on the HeLa cell and who Henrietta Lacks and her family was. And that was really my first time really knowing who Henrietta was and what contributions she made to not only, the United States, but the world. As we know, Henrietta Lacks was used to go up in space to test zero gravity. They used it to create the vaccine, the polio, stem cell research, in vitro fertilization. I mean, you name it, the HeLa cells have contributed. So as we move forward, the author of the book, The Immortal Life of Henrietta Lacks, Rebecca Skloot, she reached out to the family, and my uncles and my granddad, they wanted no parts of it. I mean, because they thought like, here's somebody else trying to come and take advantage of the family. So my mother, being the trendsetter that she is, she gave Rebecca a chance because my mother wanted to know who her mother was. She wanted to know the things that she liked. Did she like to dance? What kind of person she was? So her and Rebecca developed a rapport, and they started going around to different family members down in Clover, Virginia, which is in Halifax County, conducting little personal interviews to find out who Henrietta was. So the book took 10 years to write. And there were a lot of things that my mom didn't know about her mother that she finally found out. Also, a lot of things that she found out about her sister Elsie, who passed away at age 15 in Crownsville State Hospital. That was a very disappointing and heart-wrenching part of the book to me. So as the book was almost completed, my mom was already suffering from heart disease, and she passed away like 9 months before the book was released. So Rebecca, she went on and published the book, and the Immortal Life of Henrietta Lacks has been instrumental part of getting the information to people about Henrietta. As we all know, it's a required reading for a lot of universities and high schools. I mean, I be on a plane sometimes and I see people reading the book, and I might walk up to them. I'll be like, "It's a nice book, right? Very informational." And they be like, "Yes, you ought to read it." And I'll be like, "I've read it quite a few times." You're right. "How you doing? I'm Henrietta's grandson." And they be like, "Really? Can I have a picture?" Okay, wait till the plane lands and we can take a picture. But a lot of people ask, well, how does your family feel about what Johns Hopkins done to your grandmother and to your family? I think it's like how you perceive what's right and what's wrong. I think wrong was done, but not intentionally, because of the time, 1951. Race played a major part. In Baltimore, we all know that Johns Hopkins was one of the only places that African Americans could go and get treatment. So, I mean, I really feel like out of the bad that was done, you can't be upset, you can't be vexed or anything like that, because of all the good that have came out of the HeLa cell. It just warms my heart when people come up to me and tell me that your grandmother saved my life. I had cancer because of your grandmother. I have children because of in vitro fertilization, stem cell research, everything. So when I see the HeLa cell that came from my grandmother, Henrietta, saving lives and contributing to so many great advancements in the medical world, it makes me happy. It makes me proud. So my mom, when she passed away, I vowed that I would continue to push forward and to get out about the legacy of Henrietta Lacks, to keep it alive. And I shared last night that I'm in the process of getting her on a postage stamp. We have a street named after her in Baltimore. We have a highway dedicated to her in Baltimore. There is a building that Johns Hopkins is constructing as we speak, and it's going to be named after her. I know that there's not, monetary, money given. A lot of people ask that question, well, have you been compensated? No, we haven't. And like I shared last night, if Henrietta was not an African American woman, I think the family would have been compensated. And it wouldn't have taken this long. But Henrietta left a platform for her family to be able to take advantage of. So I'm here to talk about disparities and, poor neighborhoods and things like that, where people, they tend to not want to participate in clinical trials. I'm getting ready to partner with the ACR and go around and speak to people and let them know, hey, look, it's very important that we participate in clinical trials, because we need people to participate, because the medications that they're creating, it has to be for us. Because if they're creating medications for people not of color, then a lot of times it don't work on us. It doesn't work. So, we need to let people know that the mistrust and the disconnect between, communities and academia, it happened to me, it happened to my family, but it might not help you, but it will help people behind you that's coming in the future. So Henrietta saved lives, and that's what I'm doing, so to speak, also. As I said, I live in Baltimore, Maryland. I have a transitional housing program, and I help transition men that's coming home from incarceration. I felt like it was a mission that I needed to dedicate myself to, because I've been there and I've done that. And I know that there's men coming from prison that doesn't have family support to be able to transition back into society. I shared last night that a guy just came into my house 3 weeks ago. He was locked up for bank robbery. He was locked up 30 years. And when he got out and he was in a federal halfway house for 5 months. And they just kicked him out. No resources, no support, anything. He tried to get jobs. He tried to reach out to family members, nothing. So what did he do? He went into another bank, and he robbed the bank, and he didn't take the money. He left out and he went across the street and sat on the curb and waited till the cops came and arrested him. So he was locked up for another 2.5 years. And then his caseworker contacted me and said, Tony Wright needs help. And I think your program will be great for him. And I went and I spoke, and the judge released Tony, released him into my program. He's in my program right now. We're in the process of getting all his documents and his ID so he can get a job. I took him to the supermarket so he can buy food, and it was just overwhelming for him, like to be in a place with so many people and so many things going on. So that's what I'm doing, to give back to society, to help lives and to help men, to be able to come home from prison and to take care of themselves and their families and not be a danger to society. So I'm here. I'd like to thank Dr. Powdery because, she's been very instrumental in getting me here. Her and Jenny and Dr. Laura Botello, thank all of you for bringing me here.
Well, we don't have too many standing ovations around here, so just so you know. That's awesome.
Thank you.
As I told Mr. Carter last night and yesterday afternoon, I had heard his cousins as well speak at a research ethics meeting a few years ago, and I told them as well, I think their grandmother would be very proud of them and what they've done with this story. I mean, clearly, the state of medicine and informed consent in 1951 was very different than it is now, but we did have some consent for treatment, probably much less for research and none for tissue cultures, But one of the things as I looked back at the book to get ready for this visit, there was a quote from Alfred's mother, Deborah, who, when she found out about all the wonderful things that had happened in medicine because of Henrietta's cells, she said, well, she did all these things for medicine, why can't her family afford to go to a doctor? And I think that's really the crux of the issue in terms of disparities. So for the most part, I think you don't want to hear from me. I think you want to hear from him, and we want to hear from you what you would like to hear from Mr. Carter. So we have some student volunteers. I don't know how much informed consent went into that voluntariness, but the students are running around with some microphones if you all would like to ask Mr. Carter some questions. Yeah. Oh, you got... if you can, just identify yourself and say kind of what... just like who you are and what you do here, so we know.
I'm Dr. Tom Dekimus. I specialize in radiation oncology. Cervical cancer, thank you for a wonderful speech.
Can you hold the microphone closer?
It's very...
That's better, thank you.
I am Dr. Tom Dekimus. I specialize in radiation oncology. I'm from South Africa, Durban. Cervical cancer is very close to my heart because it happens mostly amongst the women of color. But I just want to share with you, sir, regarding the treatment of cervical cancer brachytherapy, which goes straight into the cervix. The treatment is very diverse, and some centers will thumbsuck some of the treatment in other areas. We still really need advocacy on that area, like in the center where I was, some patients were treated exactly as your great-grandmother, and I think we really need your support in advocating for cervical cancer patients. I know that you are doing great on prison reform, but we really need someone to advocate on cervical cancer to unify the treatment, because in my center, patients were treated exactly like your grandmother, and I was vocal, highly vocal, on eradicating that treatment, which was changed in 2013. From 2016, patients were treated with the wrong dose, which was 7-gray stat, which is just like pouring water on a patient's. I just wanted to make you aware. I know radiation oncology is not part of this program, I'm requesting maybe if possible that because colorectal cancer, although you don't treat with radiotherapy right in the first stages or in the primary stage of treatment, where they use more chemotherapy, but palliative, we use radiation. So I would really appreciate if we can incorporate radiation oncology and invite some radiation oncologists, because there's really a lot of things that are ongoing that you may not be aware of.
Thank you.
Do we have other, yes?
I have a question.
Okay.
My name is Antonio Baines. I'm a pancreatic cancer researcher. Again, thanks for coming. Really, this story is a really touching story. So I have a question. Do you and the family still have a relationship with the author of the book that came out, and how is that relationship, or are there any funding that's going to the family? I'm just curious from that, because again, some people have commented on
Right.
that relationship.
Right. No, ma'am. Like, okay, to answer your question, yes, we still have a relationship with Rebecca. It's been a lot of speculation on the subject of when her and my mother was writing this book, that they had some sort of contract or some kind of agreement. So when my mother passed away, like, no one knew because my mother didn't discuss it. And if she did have a contract with Rebecca, with my mother being gone, Rebecca is not going to come out and say, well, I owe this family X amount of dollars. So what she done was she constructed a foundation, and proceeds, a certain percentage of the proceeds from the book go to this foundation, and it's only used for if you want to go to school, for medical treatment, like emergency things, but it's only a $10,000 cap.
That's an important piece of information.
Right. So she's in China right now, so I mean.
But that's why we have you here, not her.
Right. So yeah, I mean, I would love to know if she really had a contract with my mother or not. But to me, she isn't being fair with the family. But I can't hate on her because she wrote the book. She's reaping the benefits from the book. That's why I said it's up to us as family members to find our own lane.
So I have a story that I didn't tell you about that, actually. When the book first came out, Rebecca was doing the rounds of bioethics programs, and I actually tried to invite her here. And it was shortly after the summer after the book came out. And she had an agent already, Kenny. Kenny went to SUNY Albany. I still remember many conversations with Kenny. But her honorarium at that point was $15,000. In the week it took me, although I had that money thanks to the Conley Foundation, which funds my division, I wasn't comfortable paying that to one person. I pay a respectable honorarium. I thought it was outrageous. So I said, I need to talk to somebody higher than me, even though I have the final say on the use of my funding. In the week it took me to do that, it went up to $20,000. And I said no. And then I heard some members of your family speak, and I said, I don't want her, I want you. When I said that's why you're here not because she's in China and we couldn't get her. You're here because we wanted to hear your story.
Thank you.
And right. Well, it is ethics, exactly. And as I said to the students yesterday, don't worry, we are paying Mr. Carter an honorarium. So, it is. But I think it's really important. As I said yesterday when we were chatting about this. The people at Hopkins who set out to do this were not bad people setting out to do bad things. And they were very excited when they found these cells that didn't die in their petri dishes like all the other cells did. But there was something that, you know, it's slippery slope, and it's a really important case study for us to learn from. And maybe you could share with this audience the story that you shared in response to Dr. Roman's question yesterday about what happens now when people want to use HeLa cells.
Okay, well, there was a scientist who he posted the genome online, and the family was contacted by the NIH. So they called a family meeting, and we went and met with Dr. Collins, who was over the NIH in Bethesda, and we came up with a solution that we came up with a board of family members to sit on the board at the NIH to be able to control who uses the HeLa cell. Whoever wants to use the HeLa cell now they have to fill out a form and reveal what they want to use the HeLa cell for, like what scientists are going to do with it. So we basically have a small say now in what the HeLa cells are used for.
As opposed to when these cells started to be used for things, they are still in every research lab in the country, or maybe in the world. And except nobody really thought about what does HeLa stand for, that these cells came from a human being who had a husband and 5 children. I think that's just really important to step back and reflect about that, how we, use things, and there are things in our lives as healthcare providers. And I think the other message that you touched on, which is really important, is trust. Trust between. There's a good reason for African American people and other vulnerable populations, people of color, poor people, many of the people we take care of in this medical center, to not trust us, because there were bad things that were done to them. So we have to the Tuskegee study as well, exactly. So I think we need to, the person who wrote the book Bad Blood about the Tuskegee syphilis study is a very close friend of mine. And he still gets phone calls from researchers saying, what is this Tuskegee thing, and why won't people participate in my studies? The answer is that there's a lot of myth as well but it's based on the fact that bad things happened, and we need to be cognizant of that. I'm the very squeaky wheel in our IRB, the Institutional Review Board. We talked about that yesterday, what those initials stand for, about how even though a study might seem relatively benign, we can't just decide that the community is going to participate. We need to talk to them about it. And of course, the Arthur Ashe Institute here does a lot of work in that regard, along with the Disparities Center. So, other questions? Dr. Salafu. Dr. Salafu says we have 5 more minutes. Somebody who's got do you have the microphone? Go ahead. Go ahead.
Hi, my name is Janine Bada. I'm a graduate of the School of Public Health here, and I work for the cancer support community as a clinical trials educator. I also worked for 8 years for Emerging Med, a clinical trial matching service. And I just want to add to what you're saying about the barriers of vulnerable populations not participating in trials. I can't tell you how many hundreds or maybe thousands of times I've spoken with patients on the phone who can't get into a trial because they don't have the right health insurance. That shouldn't be happening. They can go to trials at NIH and NCI, and there are some pediatric trials that children can get into, but for the rest of the United States, it depends on what kind of insurance you have. Not at every institution, but at a lot of them.
It shouldn't be.
I agree.
The health insurance should take care of your treatment. The research is separate. On the other hand, one of the dangers is that the incentive, if you don't have health insurance, if you can get into a trial, where they will take, and people will argue that as a research subject, you're often taken better care of. You get more transportation, you get more personal attention. So that's an undue incentive, perhaps, to participate in research and not realize that it's not treatment.
And real quick before we end, the reason why I do the transitional housing program is because when we were shooting the movie, The Immortal Life of Henrietta Lacks, Oprah played my mother in the movie, And
He took Oprah to dinner and paid for her.
I sure did. And what, you know, the time that I spent with Oprah at dinner, it was very enlightening. It was very real. And we talked about me doing this transitional house. I told her, because I had a small part in the movie also. I was the turn the station man that told the nurse, I'm here to give blood in case she needs it. So I did have a speaking part. And I got my SAG paper, my SAG award, my SAG papers a couple weeks later. Thank you. And I told Oprah, I said, well, so many people told me I did a great job. I think I want to try my hand at acting. She was like, no. She said, your mission is to help people, help these men coming home from incarceration. She said, this is a God moment, Alfred. She said, look where you've been. Because I was in prison for 15 years, from 2001 to 2016. When I was released in 2016, within 7 months, they were shooting this movie, and they wanted me to be a part of it. And I'm sitting down at dinner with her, and she said, look where you've been, and look where you are now. She said, this is your grandmother and your mother's spirit dwelling through you. She said, I can feel it. She said, so what I want you to do, I want you to get this house, and I want you to help men coming home from incarceration. She connected me with this guy who has a book called Righting My Wrongs. I think his name's Shaka Senghor. And him and I talked, and so thus, this is why I have the transitional house. She said, if this is what you really want to do, I'll help you. So she gave me a grant for $100,000 last year. And then she gave me another grant of $100,000 this year. The house that I have right now is not in real good shape. Like it needs some repairs. So what I'm leasing the house. So right now I'm trying to buy a house to house more men, because right now I can only house up to 6 men in the house that I have. I want to buy a building that's going to house at least 100 men. And I want this house to be a place where they can come and receive training, like trades, electrician, plumbing, HVAC, things that men, when they come out and they receive this training, they'll be able to take care of themselves and their family without struggling. And this is my vision. This is my mission. I have a board set up outside, so when you all come out, visit my board, you know, I'm asking everybody to help with the my mission to get this house. What I'm doing is it's like a limited edition. It's like 2,000. It's only going to be 2,000 posters of Henrietta with her actual signature on it. I'm the only one who has her signature, and it's only going to be 2,000. You all will be the first people. You all the first people to know about this. I'm going to the ACR in Atlanta the end of this month, and I'm just ready to take this to another level. I was telling a young lady last night that this is not just going to be something in Baltimore. This is going to be something in every major city, in every community where there's men coming home from incarceration and needs help.
Like I said, your grandmother would be very proud of you.
Thank you.
Unfortunately, I think we have to end because I think we need to move the program along. But I again would like to very much thank Alfred for coming and sharing his story with us. And I hope that this is the beginning of a long relationship between Downstate and you and your family.
Thank you.